Meet Sarah. She's an active mom, someone who loves her morning jogs and yoga sessions. But recently something doesn't feel quite right. She noticed a strange pressure in her pelvic area and it's getting harder to ignore. It starts gradually, a heaviness, a feeling like something's out of place, and she's not alone. Many women experience this but often feel unsure or hesitant to talk about it. What Sarah is experiencing is something called pelvic organ prolapse, or POP. It's more common than many think, and it can impact women of all ages, though it's more frequent as we age or after childbirth. To understand prolapse, let's look at the pelvic floor. Imagine it as a supportive hammock of muscles that holds up our pelvic organs, the bladder, uterus, and rectum. Over time, due to certain factors, this support can weaken, causing one or more of these organs to slip downward, pressing against the walls of the vagina. Pelvic organ prolapse can happen for a few reasons. Pregnancy and childbirth are leading causes, especially after multiple births or complicated deliveries. But it's not just motherhood. Aging, hormonal changes during menopause, and even chronic conditions like obesity or respiratory issues that involve heavy coughing can weaken the pelvic floor. Even heavy lifting and certain high-impact sports can put added strain on these muscles. The symptoms can vary, but they're often uncomfortable and impact everyday life. Sarah notices a bulge near her vaginal opening, and it sometimes feels like she's sitting on a small ball. There's also an increase in urinary urgency and occasional back pain. Others might feel a dragging sensation in their lower abdomen, difficulty with bowel movements, or experience urinary leakage. Feeling frustrated, Sarah decided to see her doctor. Many women feel hesitant or embarrassed, but talking to a healthcare provider is key. During the exam, Sarah learns more about her prolapse, which gives her peace of mind. There are different stages of prolapse from mild to severe, and the treatment plan often depends on how much the prolapse is affecting daily life. Fortunately, Sarah has options. One of the most effective approaches, especially in milder cases, is pelvic floor therapy. This involves specific exercises like Kegels, which help strengthen the pelvic floor muscles and reduce symptoms. A pelvic floor therapist works with Sarah to tailor these exercises to her needs, and over time she notices a real improvement. For more support, Sarah's doctor suggests a pessary, a small device inserted into the vagina to help hold up the prolapsed organ. It's an effective non-surgical option that's also easy to remove. In more severe cases, or if non-surgical options don't provide enough relief, surgery might be recommended. There are a few surgical options to repair or lift the organs back into place, depending on which organ is prolapsed and a patient's health goals. These procedures can be effective, though they often require a recovery period and may have some risks, so it's important to talk to a specialist and consider all options. If you're experiencing symptoms of pelvic organ prolapse, don't hesitate to reach out to a healthcare provider. Treatment and support are available, and you don't have to face it alone.